In 1918, a group of visionary optometrists created a dedicated professional body charged with fostering optometry as a vital Australian primary healthcare profession. 100 years later, we are a modern, dynamic organisation committed to continuing their work and dedicated to servicing the largest community of optometrists in Australia. Throughout history, we have been constant in our obligation to lead, engage and promote optometry, optometrists and community eye health. In the 1950s, we lobbied to introduce a world-class education system to support our profession, and today 6 universities offer highly sought-after optometry degrees that attract students from around the world. In the swinging 60s, we turned our attention to streamlining patient referrals, which has from the 1970s onward enabled direct referrals from optometrists to ophthalmologists. And our success in 1975 to secure subsidised optometrist consultations under Medicare, or Medibank as it was known then, has today paved the way for more than 9 million people accessing subsidised eye examinations each year. Our work advocating for Medicare rebates to support patients' access to the primary eye care they need has continued, and we now have a comprehensive suite of Medicare items for optometric care. Throughout our history, we have been vocal in the need for optometrists to be fairly compensated, and we have been successful in uniting our members to rally the government to reverse decisions that threaten ready patient access to optometric care. The 80s proved a vital decade for optometry, when after years of sustained lobbying, the laws changed to allow optometrists the right to administer diagnostic drugs. In 1996, our actions saw government attempts to remove the Medicare rebate for optometric consultations overturned, and more recently, we succeeded in removing the cap on what optometrists can bill under Medicare. And we achieved further progress in 2010 when optometrists were able to prescribe topical medications for eye disease under the PBS for patients. Throughout these years, we have continued to evolve our member services through the introduction of our dedicated member support line and via a breadth of resources to support quality clinical practice and professional practice. We remain passionate about ensuring that consumers and other health professionals embrace the role of our profession and the importance of eye health and vision care management. But being successful does not involve simply highlighting key achievements. We need to also look forward to ensure that we are at the forefront of change driven by demographic, technological, political, social, and economic forces. This is why we have launched Optometry 2040, a significant project involving all areas of optometry collaborating to consider initiatives to create a sustainable and successful sector for generations to come. We will be there with you and supporting you, as we have done for 100 years.